This is an example of effective patient and family-centered rounds. Effective patient and family-centered rounds promote a safe and respectful learning climate. Include synthesized and concise case presentations. Get a commitment from the presenter as to his thinking. Target teaching to one teaching point. Direct learners to read and report back.
Good morning, Ms. Johnson. My name is Dr. Smith. I'm the pediatric intern on the team this morning. I wanted to introduce the rest of our team. This is Dr. Jones, the attending on our team.
Nice to meet you.
Nice to meet you too.
You, of course, know Sarah, your nurse. This is Joyce, our case manager. This is Miss Cook, the medical student on our team. And Dr. Post, my senior resident. How is Jessie doing this morning?
About the same, I guess.
I had a chance to speak to Mrs. Johnson this morning about her concerns about how Jessie is doing, and she's very concerned he's not getting better despite everything we're doing. He's not very interactive, and he's just not right.
I understand that concern. We do have a little more information about what's going on with Jessie. And if it's okay with you, I'd like to tell the rest of the team Jessie's story and why he's in the hospital. I'll go over the lab test and go over what I'm thinking and what the plan is for today. Does that sound okay?
That's fine.
This is Jesse Johnson. He's our 7-year-old boy admitted with worsening pain, unilateral neck swelling with high fever despite antibiotics. Jesse was well until 5 days ago when he presented to his pediatrician, Dr. Kirk, with right neck swelling and fever. A presumptive diagnosis of lymphadenitis was made, and Jesse was prescribed clindamycin 3 times a day by mouth. Throat culture and rapid strep at that point was negative until yesterday. He was doing okay, and then he developed a rash on his body. He also developed swelling of his hands and feet, swelling of and redness of his eyes as well. His pediatrician was worried that he was having a reaction to the clindamycin, so he stopped the clindamycin and started on Benadryl yesterday. But the rash and swelling have not gone away. His fever has ranged from 101 to 104 and has been responding only to Motrin. His neck swelling is bigger, and all he wants to do now is pretty much sit on the couch, watch TV, and sleep. His mother says that he's drinking a little less, but he's urinating normal amounts as well. However, he's having trouble walking, so mom's having to carry him to the bathroom because his feet are so swollen and hurting him so much. Any questions about the story?
No, please continue.
Okay. On exam, Jesse has been ill-appearing and prefers to sleep. He will wake up to answer any questions and answers appropriately. He's been febrile to 38-40 degrees. Otherwise, his vital signs are normal. His IV is running at maintenance. Urine output is normal. His bulbar conjunctiva are still a little red. His lips are cracked and his tongue is red, but his tonsils are normal. He has a 4 by 6 centimeter firm, tender, right anterior cervical swelling that really limits his ability to turn his head to the right. There's no other adenopathy that I was able to appreciate this morning. Chest, heart, and abdominal exams are all normal, and you can see his diffuse red fine rash on his trunk. The dorsum of his hands and his feet, as well as his fingers and toes, are all swollen and red. We did get some of the lab tests back, and his CBC showed a high white count of 18,000 with a left shift. His ESR was 110, and blood culture is pending. Ms. Johnson, does that sound correct?
Well, I mentioned to the nurse earlier today that he had a virus about a month ago that caused his chest to be congested. Do you think it is related? I mean, he wasn't tested for strep then. Has his lab tests and x-rays come back?
We have gotten some of his lab tests back. The white blood cell count and a test for inflammation called ESR both came back high. His urine had 25 white blood cells in it, but no bacteria. His chest x-ray was normal, and the rapid strep test was negative. Sarah, do you have anything else to add?
Just that he did develop a fever about an hour after I gave him Motrin this morning.
Okay.
Dr. Smith, how do you put the findings that Jesse has, his signs and symptoms, and the lab tests that we've gotten back together? What's your assessment?
My assessment is that Jesse really has unilateral neck swelling and fevers that have persisted despite clindamycin. I really think that it's due to a resistant organism and possibly an abscess formation. So we've started him on vancomycin, made him NPO for a CT scan later this afternoon. I also want to consult ENT to come by and see him after the CT is done. I'm not sure what to do with the Benadryl. I don't think we should continue it because I really don't think it's helping that much.
Okay. Dr. Post, what do you think?
I think that was a very good summary and diagnosis. I agree with his plan. Although I do think we can start with an ultrasound to look for cervical adenitis.
Ms. Johnson, I want to take a minute to be sure that you understand what it is we've been talking about and to see what concerns you have about what we've said about the diagnosis for Jesse.
I just think that he may be getting sicker even though he's taking a strong antibiotic, and I'm worried.
So, Mrs. Johnson, I think that Dr. Smith and Dr. Post have done a good job of putting Jesse's symptoms together with the lab tests and coming up with their assessment. But on the first day that the patient's admitted to the hospital, we usually like to challenge ourselves as a team to make sure that we have the right diagnosis. So we would like to think about another diagnosis or two that might have similar signs and symptoms and lab results as Jesse. And so we're going to take a minute to think together as a team out loud. Is that all right with you?
Oh, that's fine. Anything to help Jesse feel better.
Okay. So maybe we can start by saying, what are the key findings that you see with Jesse's illness?
I really think the key things are the cervical lymphadenitis, the fever, the rash, and then the hands and feet being red and swollen.
What about his red eyes and his red cracked lips? How do you put that together?
I was attributing those more to the reaction he was having to clindamycin, something like Stevens-Johnson syndrome.
Yes, I think your thought about the Stevens-Johnson syndrome makes good sense because it's an inflammatory process, and similar to an infection, an allergic reaction can have signs of inflammation. But is there any category of diagnosis that also has signs of inflammation that we haven't considered?
Do you think this is a vasculitis?
Yes, I think this is a vasculitis. And in your experience, what are common diseases that are associated with vasculitis in this age group?
Could this be Kawasaki's disease?
Yes, I think Kawasaki's is the right diagnosis.
I think that's right. I don't know why I didn't think of it initially. Maybe it's because he's older and started with cervical adenitis first. I've usually seen Kawasaki's in preschool-aged children, and it starts with a high fever and a rash.
That's exactly right. We usually see it in younger children. Nicole, have you ever seen a case of Kawasaki's disease?
No, I haven't. I've only read about it.
Mrs. Johnson, is it all right if Nicole takes a little closer look at Jesse's rash? And I'll explain to you what we're looking for also.
Oh, that's no problem.
So, Jesse, is it okay if Nicole looks at your arm for a minute? Okay, Nicole, do you want to just take a look at his arm? And look to see, does the rash look to you like it's flat or it's raised?
The rash seems flat and smooth, and his hands are a little swollen.
That's exactly right. Just to recap in terms of Kawasaki's disease, it's a diagnosis that has inflammation throughout the body, and we make the diagnosis based on some key findings that we've talked about here and that Jesse has. The fact that he's had the high fever, the rash that's all over his body, the swelling of his hands and feet, the swelling of his neck, his red eyes, and cracked lips. So all those things together go along with the diagnosis of Kawasaki's disease.
I never heard of Kawasaki disease. Now I'm starting to get confused. Can you talk to Jesse's pediatrician, Dr. Kirk?
Sure, we always do that, and we'll plan to do that as soon as we finish rounds.
I can come back with you a little bit later and talk to you more about it, and I can bring some information at that time. So, do you think we should get infectious disease involved?
You know, I think it would be good to get our infectious disease consultants involved. They're specialists in this area, and although we think that we have the right diagnosis, there has been, a difference of opinion, as you've mentioned, and so we'll ask the infectious disease doctors to come by and see Jesse.
Ms. Johnson, we're trying to sort out whether Jesse has had an infected lymph node with a clindamycin allergy or if he has Kawasaki's disease. I think we're all pretty much of the opinion now that more in favor of the Kawasaki's disease diagnosis. We'll hold off on the CT scan, and that means Jesse can eat.
And you will talk to Dr. Kurt, his pediatrician.
And Sarah, I know that we've changed the diagnosis in the plan. Do you have any questions?
No, I'm clear on the plan. We will hold the CT, resume feedings, and continue vancomycin.
Great. And Joyce, do you have any questions from the home care perspective?
Well, if you anticipate any discharge needs, we can talk about them after rounds.
Is everything a little bit clearer now, Ms. Johnson? Do you have any questions?
Yes, everything seems to be very clear.
Great. Well, we're going to go and see some of our other patients, and then when we finish, I'll come back with Dr. Post and Dr. Smith and answer any other questions you might have.
Okay, thank you.
Within your group, reflect back on what you have just seen. Was there a safe and respectful learning climate? Did the presenter give a synthesized and concise presentation? Did the attending get a commitment from the presenter as to what he was thinking? Did the attending target teaching to one teaching point? Did the team read and report back their plan to themselves and the family?